the point of this month's entire topic of pain is to say, actually, pain maybe isn't a bad thing. And there's times where pain, I mean, it totally sucks. It is what it
Mhm.
is. However, the better the understanding we have of pain, the more appreciation we have for the nuance that's there. And that can really help us reframe our thinking when it comes to pain. So that's kind of the journey that we're going to be on this month is like a lot.
Welcome back. We are entering the month of September and we're going to be talking all about pain and lots of different viewpoints of pain, information, and we're really excited. I think it's a great topic. But before we get started, Dr. Jess, what is in your glass?
So I just finished my coffee and it's in one of my favorite mugs. It says, "Today is a good day." So even when you're feeling a little tired, you might pick this up and go, you right. It is a good day." So,
It's like the
um,
saying, anything, any day above ground is a good day.
yeah, you can't help but smile when you pick this up, you know? So yeah, anyway, one of my favorite mugs. So Dr. Bobbie, what's in your glass?
I am having some iced decaf coffee with almond milk and a little bit of a French vanilla sugar-free, well, not sugar-free, but it's the sugar-free because it has no dairy
Mhm.
flavoring. So
There we go. Making it
enjoying.
happen.
Yes, yes.
Yeah. So, I know pain seems like, man, that's kind of like a bummer topic to talk about, right? Like, who wants pain? Nobody wants it. We just avoid it at all costs. However, the point of this month's entire topic of pain is to say, actually, pain maybe isn't a bad thing. And there's times where pain, I mean, it totally sucks. It is what it
Mhm.
is. However, the better the understanding we have of pain, the more appreciation we have for the nuance that's there. And that can really help us reframe our thinking when it comes to pain. So that's kind of the journey that we're going to be on this month is like a lot of reframing via education, via interviewing other people, and talking to the two of us. So enjoy. It's going to be so fun.
I feel like this
Uh,
is something you and I get to talk about, teach, educate every day
right.
in our professions, and very misunderstood in a lot of ways.
Absolutely. Yeah. So that being said, Dr. Bobbie, is pain bad?
It
I'm
can
just going
be.
to lead you right in.
Right? It can be, but it's not always.
Right.
Um, Sometimes pain is protecting our body. Sometimes it's telling us, hey, something's going wrong and you need to check it out. But sometimes it's not. I mean, sometimes it's not good, it is hurt and causes issues and things like that.
Yeah. So with that being said, when we think about pain, I think we just need to step back and say, what is pain? Right? So
Hmm.
like the big picture is that it's the brain's interpretation of a signal, right?
Yeah.
So if it's the brain's interpretation, then what is all contributing to what the brain is having to interpret?
So, like when it interprets, like if anything that touches our body, any movement that we provide, um, so if I touch my finger, there's going to be a signal that goes from my finger all the way down, all the way up to my brain. My brain is going to kind of tell me, what is that feeling? And then that is where we kind of, that's how we view pain or something that's hurtful, is just by touch. So there are times where a gentle touch, your brain can interpret it as pain, even though it's not. There's no trauma going on.
Mhm.
It just depends on what our body has been through, what our nervous system has been through. And sometimes our brain can get a little bit wacky in a way, and it can read things wrong. Just like we make mistakes, our brain can make mistakes as well.
And so why does the brain make these mistakes? Why might the brain perceive light touch as what we call a noxious stimuli or painful stimuli?
So I think that's a great question, and I think it's a lot of times misunderstood. So when something is injured, it's going to send signals to our brain, and through it's called your nervous system, your central nervous system, and you're going to send signals through there up to the brain to tell it there's trauma. So if you're touching a hot stove, you're going to move your hand. It's going to get you off there. But sometimes when you've had a lot of trauma or a lot of pain over time, those signals keep firing, and almost your nervous system changes to tell you anything that happens, any even wind blowing, a sheet touching your hand. It's going to take those signals and your brain rewires, and it's going to tell you that those are all painful things that are happening.
Mhm.
And it just kind of continues like that. And it can honestly get worse and worse and worse. And your brain, they've even done studies where they look at like how your brain lights up when you feel pain. And over time, they've seen the areas start getting bigger and bigger and bigger. So it's just like if you've ever hurt your shoulder, day one, it hurts right here. Like you put one finger right here. Week one, after the first week, you're like, oh, well, this kind of area is bothering me. And then you hear people, and sometimes we think they're like, are you really telling the truth? But a month into it, if they haven't been treated, if they haven't gotten help, they're like, the whole arm hurts. I can't use the whole entire arm. And it's like, well, when you first happened, you said it was right here. You had one finger. And that's kind of what our brain, how it can remap and really spread out and take that pain and spread it over a big area.
Right. And with that, during that time that your brain is getting bombarded with these signals that are coming in via the spinal cord and then coming up to the brain, additionally, there's other components to pain. There's the emotional component, the that psychological component, but then there's the environmental components as well. So
Mhm.
when you feel something that doesn't feel good, right? Like, ouch, there's a sense of stress that the body goes through, which can be all sorts of different things. It might be thoughts that are like, oh no, I'm not going to be able to complete X, Y, or Z on my schedule. I'm not going to be able to lift my child. And that, you know, kind of impacts my sense of worth and self. All the things that you might not be able to do or that you honestly can't do because of whatever happened, that then creates the psychological component, and that also participates in the brain's perception of of the pain. So it's quite interesting what can happen. And then you lead into the environmental components of, positioning that you're doing, any like how you're sleeping, how you're sitting, how you're posturing, like all of the different environmental things that you're doing that can also contribute. So that's what happens, like example of shoulders is like, because this hurts, the muscles in the neck are going to start to like guard that
Mhm.
shoulder. So now all of a sudden we've got this neck pain and shoulder pain, and then that turns into headaches, right? So I
Mhm.
see this all the time, and it's the brain is like protect, 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 because of the environmental, like, I need to protect myself from my surroundings. If something touches this, I'm gonna hurt more. And then that honestly makes it worse because it doesn't know that, like, elevating this is gonna contribute to a headache. All it is going into is, like, full on defense mode, and there's not, like, necessarily a good way to, like, understand how to get out of that unless you're working with somebody that can really help guide you along the way. Or
Mhm.
listening to an episode like this can help you really reframe a little bit when something happens and like take a step back and pause and say, what is going on? And so that's kind of one of the purposes of this month, is to really just say, let's like take this chunk of information, which is pain, and see if we can start to like kind of better navigate and understand what's actually going on.
I like to teach my patients, especially if it's like so if someone has an injury, and let's I shoulder is easy to use. Someone injures their shoulder, and then they want to, when we injure something, what do? We don't want to move it. We're scared to move it. It hurts to move it. So we hold it here. And I always try to explain to people, so you have this pain, so you stop moving. When you stop moving, and that's actually going to cause more pain. And
Right.
it's this cycle that goes, like, I always call it going down the toilet. And at some point you have to break it, and it's uncomfortable to break it. It hurts if you've been holding that arm for even a week, even a few days. You hold that arm tight to your body, guarding it. And some of it's you not doing it, us not doing it on purpose.
Right.
Um, when you have injury, there's inflammation into the muscles. The muscles cause a contraction. There's a chemical that is going on in there. And so when your muscle contracts, it releases calcium into your body. In order for that muscle to relax, that calcium through a bunch of different chemical processes has to be brought back into that muscle, and then the muscle can relax. Well, when you have an injury, a lot of times the calcium can't get back in because there's like something blocking it, a chemical blocking it. And so you have to do some stuff, do movement, do soft tissue, do a lot of things that we're going to teach you about later on, but you got to start moving. And but it's a cycle, and to break that cycle is challenging, and it's hard. Um and it's uncomfortable. But
Right.
in the end, you end up feeling a lot better.
Right, exactly. Yeah, and so it's like it's really interesting because sometimes we have pain that is means that you are in danger, something bad is happening, right? Like we use the example of touching the hot stove, or let's say you like broke your leg, literally, like your bones are going in the wrong direction. So pain is really important. Like we don't want to block all of our pain signals because if we blocked our pain signals, we wouldn't be able to get ourselves out of danger because we wouldn't know danger exists. And that's one of the number one reasons why people that have neuropathy, like whether it's because of diabetes, chemotherapy induced, anything like that, and they can't feel the bottom of their feet, they're more likely to get wounds and, not be able to know that because they can't feel it. And so that's the problem. So we don't want to say pain is bad, we're going to block it. Pain is how we make sure that we're safe, right? So there's that like innate sense of like it's a really important thing. Now,
Mhm.
how we experience pain is uncomfortable. The whole point is that it's uncomfortable. That's what wakes us up to react to it. So then being able to reframe and say, okay, is this just being uncomfortable, or is this something that's a signal that's been going on for too long and I'm just responding in emotional ways, guarding all of that other stuff? And not emotional being a bad thing. I mean, this is what happens. Anybody is going to respond to the stressor of pain. It doesn't matter who you are. You're going to go, wait, I don't like this. I want to get away from it. So, because it's
Yeah.
uncomfortable. So,
Well, and I think if so talking about, you said there's a lot of different aspects of pain:
yeah,
environmental, emotional, psychological, physical.
yeah,
There's a lot of aspects. If we're looking at the psychological aspect of pain, and I am so guilty of this, sometimes our anticipatory thoughts are worse than what the pain is actually is. And
right,
this is when it comes to, for me, shots. I
right.
don't know,
Taking shots.
shots
Yeah,
and blood draws. I am scared to death of them. I've gotten better because I've had to recently, but I would have to get when I used to get my blood drawn, I would like almost be passed out. Like they'd have to lay me on the table. I would be hot. I'd be sick. I'd have like a physical reaction on something that really doesn't hurt that much, but it's just in I anticipated. I had this feeling of like, oh my gosh, this is miserable. This is gonna be terrible. I'm dying. And it's really not that bad.
right. And that again, and that just highlights the psychological component of pain and that because of past experience. So that's what happens is that the brain learns as we go through life. So if we've had some sort of a traumatic experience. So for example, if you were a child and you needed to receive vaccines and they pin you down and you're kicking and screaming and boom, they hit you with the needle, right? Your brain is going to remember kicking and screaming is associated with the needle. See what I mean? So, unless over time that experience was reframed, even as an adult, you're going to feel like kicking and screaming, but it's inappropriate to kick and scream. So, because you're fighting that response so hard, you're feeling nauseous because your nervous system is working so hard to not kick and scream. It's taking every bit of your energy, and you're getting a sympathetic response via nausea, blood. You can start to have elevated heart rate. You can feel sweaty, clammy. You can feel like you're going to pass out. That's just you fighting the fight, right?
Mhm.
So that's what happens with any painful experience, by the way. So if we, hit our toe on something really hard, and it's like you can barely even speak because it hurts so bad. Now, the next time you even like brush that toe, it might not hurt that bad, right? but you're like, you're so tense because you're like, oh my gosh, I hit my toe again. And then you're like, oh, that wasn't that bad. Why did I that was kind of crazy. Anyway, and then you go about your day. So because you learned that if you hit your toe, it feels like it's broken because you have broken it in the past, but this time was a different experience. So all of that experience that you have with pain over time leads to memories being formed and associations. And so that's
Mhm.
the other thing that happens. So that part of the learning process is what sometimes needs to be broken if we're having a difficult time managing pain. So that's kind of what we're going to get into next episode is talking more about chronic pain versus acute pain. So this episode is more just like what's the big picture, but really kind of getting the concepts out there of we've got physical pain, like pain, fibers that we can feel that send the signal to our brain, physical pain. We've got the psychological and emotional component, and then we've got, the other components, where, with like environmental things like that. It's all of these things combined, all of this input, memories, pain fibers, the, whatever thoughts, belief systems we have, like I said, if this is impacting your ability to think about like how am I going to fulfill this role in my life, like if I'm going to be out of work, any of these things, these are going to be really big belief systems about sense of self. That's going to exacerbate it as well. So all of that combined is what your brain's going to use to interpret how much pain are we feeling. So
Right.
that's
Yeah.
hard. That's very hard to know as a lay person that's not in the medical field because all you know is ouch, right? Like you don't
Right.
realize all of these other components that are happening with it, which is why you're like, sometimes in the healthcare field, you can feel like you're being a little bit gaslit. And so, Dr. Bobbie, why sometimes is it hard to get the diagnosis and feel like people are understanding your experience with pain?
Well, I think as healthcare providers, I think we need to listen better and like actively listen so the patient feels heard. I feel like a lot of times when I'm working with patients, they just don't feel heard.
Right.
And I think as doctors and as therapists, because I'm not going to say we're not excluded from it, we see and work with pain every day. We have an understanding of what it is. And sometimes we're not going to know exactly why the pain is there. But what we need, um, because sometimes you don't know. Like we can't figure it out. Sometimes we can. Um, I lost my train of thought.
So essentially, like if we can't figure it out real quickly,
Oh
like
yeah.
it's like this is definitely, straightforward rotator cuff tendonitis, boom, 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 all the
Right.
tests are positive. What the patient's reporting versus what the positive findings are correlate, we're good to go. That was easy peasy. So we've got an
Yeah.
answer. However, the person that has the past experience, the past memories,
Yes. Yeah.
the
Okay.
emotional component, their subjective report isn't going to match the objective findings. And that's when we start having difficulty with people really getting an answer to what's going on because it's more complex than what the testing is showing, which is
Yes.
x-rays, MRIs, physical exam, all of that might not be showing what they're reporting, right? So
Right.
like why might that not be the case? Like why would imaging not give us every single answer?
So a lot of that, when things aren't matching up, a lot of it is because that change in the central nervous system has already happened. That remapping of the brain has already happened. And it's not something we as humans choose to do or can consciously do. It is something that happens, and they have studies that show within 24 hours of your injury happening. So it's not someone being crazy. It's not someone being over dramatic, nothing like that. It is like a physical response that your body starts to produce.
Right.
And that's when your symptoms and the problems don't match. Now, they may not match because that remapping has happened, because your pain has spread and it's very diffuse. And it's hard for us to know what area the pain is coming from. A lot of times people really want imaging. I work in a setting where they think I hurt my shoulder, I need an MRI tomorrow. And the truth is unless you're going into surgery, and even then, a lot of times it misses stuff. MRIs are not great to tell you why you're in pain outside of emergent medical things. So outside of finding cancer, outside of fractures, and you wouldn't use an MRI, more like a CT scan for fractures, but just talking about any imaging in general, they aren't good for why does my lower back hurt? I can still move around. I'm still great. But why does my back hurt? It's a static image. Our bodies are moving. They're not taking a picture of your body as you move through a bunch of motions. Now, if you get an ultrasound, that is, there's different types of ultrasound, but an ultrasound is really neat because it can tell you some information while your body's moving. Not as clear as like an MRI and CT, but it is pretty neat. So that is one where you could actually see, what's going on while you're moving. But MRI, CT scans, X-rays, they're all just a static picture. We are not a 2D image. We are a 3D moving body. And they just, maybe your pain isn't in that one position. Maybe you need to kind of turn a little bit, and that's when they would see it. But they're not going to do all those MRIs, all those X-rays in every position possible to see.
Right, exactly. And so I think that's a big part of why we get some false positives and false negatives. So because
Mhm.
we're desperately trying to be able to use this as our gold standard to give us a fast answer. And so when we don't get that fast answer, it's like, oh, hmm, is something wrong with me? Why am I feeling this when like the MRI was negative or the x-ray was negative or whatever it might be?
Mhm.
But I swear I'm feeling this.
Right.
Like, is it and then, sometimes
The
what can
opposite.
happen is that people can feel like they're not being heard, because sometimes they might not be heard is the real answer, right?
Right.
Um, Sometimes they go to providers who discount their experience. This doesn't happen all the time, but it can. I've worked with a lot of people, and this has been their experience where they were discounted because the imaging was negative. So, it's like, that's not okay either.
No.
So, we can't put all of our eggs into the basket of take a picture of it, and that's how we understand it, you know? Um, yeah. So
Y-
that's we just want to say that out loud to anybody listening. Like,
y-
it's okay if the picture doesn't show anything, that doesn't mean you're not experiencing it. Okay.
Well,
So,
and I was gonna say, so two things. One, um, the other can happen. And the other, I had a patient one time that was feeling great, was in an accident. Um, I was seeing them further back in their knee, but something in my mind, like, I don't know, I just felt like there was an issue at the hip. So ultimately, patient's doing a lot better, walk around, no pain, but still just because it was a car accident, they still had them go get all the imaging, MRI. They found a ton of like a hip broke, like an old fracture, all this stuff, torn quad. The patient had no pain.
right,
So why are we going to there was nothing in there that was emergent. Why are we going to address it? But now the person's all worried because they have this MRI saying all this stuff's wrong when they just for 2 months felt fine.
right.
So I think we can also see the other side of thing. Um, and
Yeah.
then the other thing I like to say is um oh, and I always tell patients about this study. There's a study out there. They sent the same lady to 10 different places over a 3-week period to get MRIs. She got 10 MRIs of her lower back. Not a single one of those 10 results. There was not one result or one finding on all 10. Every single 10 of all 10 findings were, or not findings, but all 10 imaging were different. Some of the radiologists reported bulging discs in all 5 levels. Some reported nothing in all 5 levels. So I think it's just a good example that it's not a written in stone. And we just need to, it's a tool. It's a tool to rule out red flags, and it's a tool to give us an idea, but it is not the gold standard, as you said.
So when we're talking about imaging, we're not saying that it's a bad thing and that has no participation in like what we need to do in healthcare. It's just what we're trying to say is imaging isn't the end all be all. It is a tool to understand pain. The biggest tool that it is used for is to clear red flags. So like we have to know like is there a lesion in the bone that's causing the pain? Could be cancer. Is there a fracture? Got to do something about that. Or is all of that negative? If we have ancillary findings, well, I always give the example of like, I've got gray in my hair, right? That's called aging. So there's going to be findings that are associated with aging related changes that might not be symptomatic, which is okay, right? So we don't need to get all worried about stuff that is really just like, yeah, you're getting a little bit older, stuff is popping up here and there. If it's not stopping you and you're still moving well and you're staying strong, then it might be something that never, ever, ever slows you down. So we don't want to be afraid of findings. We want to use findings and have logic behind, is this important? Is it not? And so is this just data? Or is this data that's meaningful to guide my decision? So that's how I use imaging. It's data that comes in, and we use data in a bunch of different ways. The subjective report, which is what the patient's telling us, our physical exam, all of these other data pieces come in. That is then what the provider uses to interpret why do we think this is going on. So we don't want to just say this one data set is the end all be all. And I think that's sometimes what can happen. And because the subjective response, the physical exam, all of these other data pieces that we really need aren't considered. So if we just consider the one data set, we can really be missing the big picture of what's going on. And so that's kind of the whole point. Imaging's not bad, it's good. That technology is good. It's just we can't make it more than what it is. And that's
Mm.
sometimes what happens. And that perception happens to patients, right? I am not going to feel better until I take a picture of my pain. It's just a data set. It doesn't change how you feel. Like, it's not an intervention. Like,
Right.
you
It's
take a
not.
picture of it, you still don't feel better. Click, click, you know? So I think it's just trying to reframe imaging. And how we look at it, how we use it, and it makes it more of a realistic tool. So,
Mhm.
uh, so that's our big picture of pain. There's so much more about pain, but this is just like take a step back and let's try and understand. Is pain bad? Is it helpful? Hmm. It is helpful. It's what saves our lives.
Mhm. Yep.
That's what signals that we need to respond in some way. It can get out of hand, absolutely. And that's what we're going to be talking about in the next episode is acute pain versus chronic pain. And so that way we can really get a little bit more in-depth understanding of what do I do in these two scenarios and how can I make sure I'm making ideally a decent decision on how to move forward. So stay tuned. It'll be a fun ride this month. All right. And oh, I didn't put the challenge out. So the challenge this week is really if you are experiencing pain, right? Like literally it could be like, I like stubbed my toe, right? Like pause for a moment and consider what we talked about today. So pause and think, am I having an emotional response to this? Like, is this bothering me more than it should? Or is it literally just like, nah, we'll stop and I'm okay? But like each time something happens, if you just take that pause, which is where we just pull mindfulness into literally every aspect of what we talk about, but you pause, that's mindfulness. Pause and say, huh, I'm okay. Or, hmm, I should probably do something about this. This is not okay. Blood's pumping out, right? Pause, do something. So all right. All right, everybody. So stay tuned. Like, I mean, obviously we love pain. So, I mean, we love talking about pain and educating. We don't love experiencing it. Thank you for listening to the episode today. If you would like to learn more about how Two Gals can support you, then join our Two Gals Insiders membership, which can be found at www.2-gals.com. Also, don't forget, follow us on social media. We're on Facebook as well as Instagram. Okay, everybody. Bye. Enjoy your week.